Welcome to this waste segregation presentation. Please pay attention to this short training package to ensure waste is being handled properly. Why is waste segregation important? Proper waste segregation reduces the chances of infection. It is part of correct patient care. Using the correct waste stream is part of how we keep our patients and staff safe. It is not optional or something that can be ignored because we are busy. Following the correct waste stream reduces costs. Infectious waste costs more to dispose of. And whilst the Trust will happily bear the cost of disposing of genuine infectious waste, it does not want to fund waste being treated as infectious when it isn't. Your help in this is very much required to reduce this unnecessary cost. NHS England have set new waste segregation targets. This means we should strive to ensure that 60% of clinical waste produced in our trust should be offensive waste. We also need to aim for only 20% being infectious waste. The final 20% being other forms of hazardous waste, such as cytotoxic, biobins, sharps, and anatomical waste. This change is occurring because significant amounts of non-infectious waste end up in the infectious waste stream, which costs the Trust a lot more to dispose of. To hit these targets, we must ensure that the correct signage is on bins and that the correct waste is going into the correct streams. Know your waste. Offensive waste. Offensive waste is not infectious, but may contain body fluids like blood secretions or other secretions, and should be placed into black and yellow tiger bags. Infectious waste. Infectious waste is waste that comes from an infectious patient or area. It should be placed into orange bags. Domestic waste. Domestic waste is non-infectious, non-clinical waste that should be placed into black bags. When an infectious patient is admitted to a side room, an infected sign should be placed on the door of the room. Clinical waste bins within the bedroom and bathroom should have the magnetic signs on them flipped over to show the orange infectious label. The bags should also be changed to the orange bags. The domestic waste bin should not be used. What to do when a patient is not infectious? It is very important that when an infectious patient leaves, that the waste stream is reverted back to normal operation. Clinical bins within the bedroom and bathroom should have the magnetic signs on them flipped over to show the yellow offensive label. The bags should also be changed back to the tiger stripe bags. Thank you very much for attending this presentation, and remember 60, 20, 20. Goodbye.